does regular exercise and walking on treadmill prevent the progress of arthritis?
Fine. I think for that, what we need to know is what is arthritis.
Hmm.
Arthritis, if in common terms you call it as, it's basically damage to the cartilage. And what is a cartilage? Cartilage is basically what we call as a covering around the bone ends in the joint. So
Okay.
what happens in arthritis? This cartilage gets damaged due to different reasons. One, it could be wear and tear. As we get older, that cartilage can be worn off.
Hmm.
Or in certain cases like rheumatoid arthritis, because of the inflammatory process, the cartilage gets damaged.
Hmm.
In whichever condition, once the cartilage gets damaged, patient starts to get pain,
Hmm.
and that pain and the restriction movements start to happen. Okay.
Hmm.
What we need to know is for this cartilage, as I told you, it does not have a blood supply, it does not have a nerve supply. That means it is avascular and aneural, we call it as.
Hmm.
For it to have blood supply, nutrition, movement is essential. So if you do not move a joint,
Hmm.
there is not going to be enough nutrition to the cartilage.
Hmm.
The cartilage will get worn off as time goes by.
Hmm.
So we advise patients that normal movement is essential. Activity should be done, and so treadmill walking, as such, would keep the joint in active motion,
Hmm.
and that helps one to strengthen the muscles and protect the joint.
Hmm.
Second, as I told you, usually provides nutrition to the cartilage.
Okay.
Third, if you do not use a joint or do not move a bone at all, as if you just in bed, we think that you're going to get better, you're probably going to cause more damage to the bone as well. The
Hmm.
bone becomes weaker. You get what you call the osteoporosis or
Hmm.
disease osteoporosis.
Okay.
So lying in bed doesn't serve a purpose. So you have to be active. But the only problem is patients with arthritis have pain and they are unable to do any activities. Movement is essential for life.
Okay. Okay.
So you need to keep moving it.
Uh-huh.
If there is no movement in the joint,
Hmm.
what happens is three things happens. One, the cartilage, as I told you, needs nutrition
Hmm.
only through movements. So if you do not move a joint, the cartilage does not get nutrition.
Hmm.
Second, the muscle around the joint becomes weak. Third, the bone loses its calcium as well.
Okay.
So I think movement is essential and you need to keep yourself active.
Okay.
The only problem with arthritic patients is because of the pain, they are unable to move.
Hmm.
So we tend to give them different ways to relieve the pain so that they can continue to be active.